Haemophilus influenza. Project by Kayvon Zlai. Influenza is a term described any illness brought on by the H influenza bacteria. That there are some illnesses that are mild, like ear infections, while others are quite deadly, like bloodstream infections. Sorry. Influenza do not actually cause influenza despite its name, the flu. One strand of H influenza influenza type B or H, it's supposed to be HIV. Sickness is prevented by vaccinations. The way of transmission is through person-to-person transmission that can occur through direct contact through the respiratory droplets from sneezing and coughing. Here are on the right side is a diagram of a influenza virus. It does include a lipid bilayer as shown here, and a few more. There's an M protein as well in there, and a nucleotide capsule. Here is a photo of it under a microscope. You can see it's very dotty, and a few on the other sides. A little different indeed. Here's the description. It's gram-negative. It is Coccobacillia. Will be presented in influenza. Catalyst and oxide assay can be used to further define the cultivity or test it of the organisms. Both results should be favorable to detect the capsular fossilharide and to discriminate between H influenza B and non-capsule species. Further serology test is required. It's basically saying a gram-negative is basically the results of a test, and this is the way you test it. Yeah, it is. I showed you that earlier, and the history. Here's the maker of it. Richard Pfeiffer initially wrote about it in 1892. He identified the bacteria H. influenza, the sputum of patients who had the flu and postulated a causal relationship between his organism and the clinic illness known as influenza. Charles Edward Winslow and the colleagues gave organism the name influenza, so that's where the name was made, founded by the man over there. But the man over here wrote the name. It wasn't until 1933 that the virus was responsible for causing influenzas, and that H. That's where the H came. Influenzas were sourced of secondary infections. The man right there, the history between it. How does it spread? There's a cell spread right there. Malady or illness is avoidable by immunization. Direct touch or respiratory droplets from coughing and sneezing can result in transmission of an illness from one person to another. So if you cough, sneeze, or anything in between, you have a chance of spreading your virus to another. Here are the effects. An ear infection can cause symptoms like pain, or here are some of the effects of the virus. My apologies. You could have an ear infection, pain, decrease in appetite, irritability, bad sleep, fever, drainage, inability to hear. It goes so bad to death. But the good part about most of these, it is found in up to 80% of it is found in children. 80% of children have it, and 20% to 30% of adults carry the gram-negative cabeolus, basically the Haemophilus influenza, in their throat and naxopharynx. Outbreaks are common, so this is a common virus. It is nothing to dwell at. So the effects are very few in between. Treatment. Antibiotics, first off, you could be treated through a vaccination. So I'll say that before going in. Antibiotics are used to treat infections, those who have been diagnosed with H. Influenza illness. People with H influenza may be sick, required hospitalization depending on the severity of the infection. Other remainders could be breathing assistance, drug for treating low blood pressure, wounded treatment for body regime with skin damage. Facts. In 1930, Margaret Pittman demonstrated that H. influenza could be isolated in a capsule typable and non-typable. So you could put in two types of capsules. She observed that the virtual all isolated from a spinal fluid SCF and blood were on the capsule type B. Here's where it really gets kind of cool. A pure placid vaccine was licensed for the United States in 1985. So that's when the vaccine was made for this and was used until 1988. The first Hib congenital vaccine was in 1987, which is the main virus. That is it. Thank you.